Good afternoon and welcome to another live broadcast with MedStar Health. My name is Karen Zingle and I'm joined today by vascular surgeon, Dr. Jason Crowner. Today we're discussing peripheral vascular disease, or also known as PVD or PAD. Did you know as many as 20% of individuals over the age of 60 has peripheral valve disease, vascular disease? PVD is a serious condition that causes reduced blood flow to your limbs, particularly your legs. So it's important that you know the risk factors, symptoms, diagnosis, and treatment for a peripheral vascular disease. I think I'm going to use the shortened version, PVD, as well as the importance of not delaying your care. So thank you for joining us. Give us a like, let us know that you're watching, share this broadcast with your friends and family, and ask your questions for Dr. Crowner in the comments, and we'll answer those during the broadcast. So first of all, Dr. Crowner, thank you for joining us today. We really appreciate it.
Yeah, you're welcome.
Of course. So before we get started with the discussion, can you tell our viewers a little bit about yourself?
Of course. Well, as Karen mentioned, my name is Jason. I am a vascular surgeon here at MedStar Health. I mainly work out of Good Samaritan Hospital and Union Memorial Hospital here in Baltimore City. I did my training. Initially, I'm from Illinois, but I moved to North Carolina many years ago now for my training, where I did my vascular surgery residency, after which I was on staff at University of North Carolina for about 5 years before coming up to MedStar. And I'm just about at my 1-year anniversary for MedStar Health.
Wonderful.
Right.
Well, happy MedStar anniversary.
Okay.
Okay.
My practice mainly centers around peripheral vascular diseases, as she mentioned, and the treatment of that, along with the maintenance of peripheral vascular disease.
Thank you. And you say it much more eloquently than I do.
My first time.
So let's get started just by talking about what is PVD and what causes it.
So peripheral vascular disease, or PVD, is basically plaque buildup or atherosclerosis of the vessels. And so the same thing that happens to the arteries in the heart, which most people are more familiar with when you say you need cardiac stents or you need a cardiac cath, the same thing can happen to all of our blood vessels. So by definition, peripheral vascular disease is atherosclerosis buildup in all the vessels of the extremities and the intestines, other than the brain and the heart. And what happens is that this plaque buildup, just if you think like a drain or a pipe, slowly the flow through that pipe or through those arteries gets less and less and less. And then you end up getting less blood flow to places like your legs or to your intestines or to your arms. And that's really where I come in as a vascular surgeon to help out.
Thank you. Who typically gets PVD, and are there some people who are more likely to develop PVD than others?
For sure, that's a great question. So the majority of folks that get peripheral vascular disease have a few things in common. Males get it more than females. Smokers get it more than non-smokers. Folks with a family history of peripheral vascular disease, folks with high blood pressure and or high cholesterol. And there's a direct correlation between folks that have heart disease can also have peripheral vascular disease. So about 30 to 40% of folks that have heart disease actually have vascular disease as far as peripheral vascular disease goes as well.
Thank you.
Well, and people with diabetes as well.
Okay. Thank you. Can we talk about symptoms? What are some of the symptoms that our viewers or others can look out for that indicate that they might have PVD?
The main symptoms that I see in my practice when we talk about peripheral vascular disease affecting the lower extremities of the legs is pain in your legs with walking. And the term we use for this is called claudication. And what claudication stands for is pain in your legs with walking that happens at a set distance every time. So for example, if I walk 2 blocks, at the end of 2 blocks, I get pain generally in my calf. It could be right leg, left leg, or both legs. That really feels more like a Charlie horse or somebody really squeezing on your calf. So kind of a strong or dull ache. And this pain, by virtue of the definition, is relieved with rest. And so folks will say that it takes 5 minutes, 10 minutes, 30 minutes that they have to sit before the pain subsides and they can begin walking again. The reason that you get this pain is because that narrowing in your blood vessels has decreased the amount of blood and or oxygen getting to the muscles in your calf that are working. And so what you're feeling is those muscles are aching because they need more oxygen, they need more blood. And that's why resting helps them to feel better. But that's the most common signs or symptoms of peripheral vascular disease that we see.
Okay, thank you. How can someone figure out that they have PVD? Are there specific tests that you use to diagnose that?
There are. Generally, when you see your primary care physician, they would do an examination. So just a physical examination where you look at the blood flow in the feet. And the way you do this is by feeling for pulses. And if there's no pulses, we have a little machine called a Doppler that we can actually listen to see if there's signals or blood flow getting down to the foot. The next step after this would be a non-invasive study called an arterial duplex, which is a fancy way of saying an ultrasound. And so you would get the ultrasound, and the ultrasound can actually look at the blood vessels in your leg to see if there's a blockage and to make sure that there's appropriate blood flow getting down to your foot. Those are the two most common ways to diagnose peripheral vascular disease.
Thank you. And what about risks for other health conditions? If you have PVD, does that increase your risk for other health conditions or even make them worse if you have underlying conditions in addition to PVD?
Of course. It doesn't necessarily increase your risk for other health conditions, but what it does is just it complicates your life and makes it more difficult from an overall standpoint. So, for example, if you did have heart disease and you underwent a heart catheterization or a coronary bypass and you needed to do the exercise regimen that comes with that, the rehab, and your legs start to walk, you wouldn't be able to walk. Or for example, if you're overweight and you need to exercise to lose weight, you would have difficulty walking if you have peripheral vascular disease, which would make it nearly impossible for you to exercise and help you to that point where you could lose weight. And so they all kind of tie into each other, where the peripheral vascular disease just compounds your other health comorbidities or problems. Along with that, there are severe forms of peripheral vascular disease where it gets worse to the point where you can develop sores on your feet that may or may not heal, along with have pain in your feet at rest. And obviously the most severe form of peripheral vascular disease down the road could lead or end up with an amputation of either part of your foot or your leg even.
Makes sense. Thank you. What about lifestyle changes? So if you have PVD, are there specific lifestyle changes that you should make? And how does some of those things, if it is, diet, exercise, are there any modifications or anything that you need to do while having PVD to help you to make those lifestyle changes?
Yeah, so the first line treatment for peripheral vascular disease, when you come in and you have claudication or that pain in your legs when you walk, would be discussing ways that you can prevent that from getting worse and actually also help to improve it. And so some of these are behavioral, and the behavioral ones would be to quit smoking if you're a smoker, to begin an exercise regimen, and that's walking somewhere between 4 to 5 times a week. And generally what I say to folks is try to walk 30 minutes each time, and you really want to push your legs. And so you want to walk until that pain stops. You rest until it eases up just enough that you can start walking again, and then keep walking. It's kind of like weightlifting for your blood vessels. So the arteries you have get larger, and then it helps form alternate pathways or collaterals past any blockages. So those first two are behavioral. And then the next would be medication changes. So if you're diabetic, making sure your sugars are in check. If you have high blood pressure, making sure you're taking the appropriate blood pressure medication to keep your pressures within the normal range. And then also taking your cholesterol medications to keep your cholesterol levels where they're supposed to be, because there's a direct correlation between high cholesterol and that plaque buildup in the arteries. Mm-hmm. And then we have a couple medications that we like to prescribe as well that actually just help dilate those blood vessels and make it easier for you to participate in the walking exercise or regimen that we talk about.
Mm-hmm. Thank you. Those are good tips for anyone, but especially people who with PVD, having that exercise, diet, and making sure you have your medications you're taking them appropriately. So thank you for that. I just wanted to take a moment just to pause and thank our viewers who have just joined us since we have been live. We are here today with Dr. Jason Crowner, a vascular surgeon, talking about peripheral vascular disease. So thank you for joining us. We've been talking about symptoms, we've been talking about risks and causes. Now I'd like to talk more about treatment. And just a reminder to our viewers, if you have any questions, please ask them in the comments and give us a like. Let us know that you are watching. We love to see that. And also feel free to share this with your friends and your family, because this is an important discussion that we're having today. So Dr. Crowner, can we talk about how PVD is treated? You talked a little bit about medications earlier, but can you get into that a little bit more, reiterate some of those treatment options and medications, and what did they specifically do to treat this disease?
Of course. Yeah, I would say that treatment is kind of a threefold process. And so that initially we try to do things that we would consider conservative management. And so those are things that you can do yourself. And that's with the behavior modification. So stop smoking if you're a smoker, start a walking regimen if you're not already walking a lot, and then change around your medications that control your blood pressure, your cholesterol, and your hemoglobin A1C or your sugars if you're a diabetic. We also prescribe a couple medications that can help with this process or help limit the acceleration of peripheral vascular disease. And so one of those is a statin. And what this medication does is it actually decreases your cholesterol and your lipid levels so that you don't get that plaque buildup in your arteries. The next is for almost all vascular patients, we prescribe a baby aspirin, 81 milligrams to take once a day. And this is an antiplatelet medication, and it basically just makes your blood a little bit thinner running through those pipes, and so it runs just a little bit better. And then we have a couple of medications that help with dilatation of your arteries so that you can actually participate in the walking or exercise regimen. So that's the first step, that's conservative management. Once we need to be more aggressive and do an intervention, then there's two ways we can do that. One is minimally invasive or from an endovascular standpoint, and the other is from open surgery. I'll touch on the endovascular standpoint or the minimally invasive first. And so, as I mentioned earlier, the process that you have with peripheral vascular disease in your legs is very similar to the process that folks have in their heart with needing coronary stents. And so the way to treat that is very similar. So just like a heart catheterization for your heart, we do angiograms for the legs. And so it's a needle stick that's in your groin. So it's an outpatient procedure. You come in, you get some sedation. It's invasive, which means that we numb up the area in your groin and we actually stick a needle in there. And then using contrast dye, we take pictures of the arteries in your leg. Now, if there's a narrowing in those vessels, just like it sounds, a narrowing, or a blockage where the artery is completely blocked off, we try to open those up using small balloons, which are just like they sound, to pop open the narrowing or the blockage. Or we place a stent, which is kind of a scaffolding or a new lining to hold open that narrowing or blockage. Generally, this is successful. If it is unsuccessful or your disease is too advanced, then we have to move to surgical options. And the surgical options are tried and true. It's what we've been doing for years and years since the beginning of vascular surgery. And basically these consist of two main principles. One would be opening the artery where the disease is, kind of like you would open a banana, and scooping out all the plaque that's causing that narrowing, and then put the artery back together with a little patch to make it larger so that this doesn't happen again. And the other way to fix the vessel would be actually, if there's a blockage in the leg, to reroute a piece of tubing, either your vein or a prosthetic or plastic tubing around that, which we call a bypass. So just imagine if you're on the interstate and the interstate goes down and Waze pops up and tells you to take a different road, you're bypassing that traffic. We do the same thing for your blood vessels in your leg to reestablish flow down to the foot. And so those are kind of the three main ways that we treat peripheral vascular disease. So conservatively with behavior modification and medications, from a minimally invasive or endovascular standpoint, so that's that needle stick where we take pictures using the contrast dye. And then from an open surgical standpoint, where we actually need to make incisions in your leg and do things such as a bypass or endarterectomy to help fix the blockages that you have.
Thank you for that. And thank you for those analogies. That really helps to understand the different treatment options. So I guess you would, depending on the case that you have, you would have that conversation with someone like yourself to discuss the different options, and then you would work together to determine what you would need depending on your individual case.
Of course, I really like to, I don't consider this my decision. I like to present the facts to the patient and where we are and what the options are, and then really make a decision together what the best thing is for you as the patient. You know, it's your life. Some folks are okay trying to do a lot of exercise programs and get their legs better from that standpoint. Other people may want to move a little bit faster towards an intervention or an invasive procedure. And some people are really surgery, you know, adverse, and they would rather not undergo surgery. They'd rather try some of the minimally invasive steps. And so I think it's just everybody's a little bit different. And so really the crux of my job is figuring out what the problem is, and then having a discussion of the ways we can fix this problem, and then deciding which one's the best for that person or that patient.
Makes sense. Thank you. We do have a question from a viewer. Barbara, thank you for your question. She's asking about her arms. So she mentions she has PVD in her legs. Her doctors have not responded to any pain or weakness in her arms. Is what she has going on in her legs the PVD? Is there something that could have been correlated to her arms? What advice do you have for Barbara?
Well, to answer your first question, of course, as I mentioned at the very beginning, peripheral vascular disease can basically involve all the blood vessels other than the heart and the brain. And so we would put it in that global category. And so the arms, just like the legs, can definitely be affected, especially the arteries kind of in this region called your subclavian arteries. They can have narrowings, and that can lead to some arm discomfort. The mainstay of way of noticing this is if you get arm fatigue or soreness or burning or weakness after long uses with your arm. So doing things with your arm, such as washing your hair, washing the dishes. And if you start to notice that your arm is just getting weaker or feeling dull, like a dull ache to it, then there's a good chance you have peripheral vascular disease. The first step for this is just like with the legs, and that's getting some sort of physical examination and some imaging. So checking the pulses on the wrist at both sections to making sure there's good blood flow, and then actually getting an ultrasound to look at the blood vessels in the arm and in here in the chest to make sure that there's no blockages. If we do see some blockages, then there's further imaging modalities that we can use to further investigate and figure out what a plan is for treatment. But my recommendation would be to talk to your primary care physician about either getting a vascular surgery consult or at least getting an ultrasound to further evaluate those blood vessels to see if maybe that's the reason you're having the arm pain and discomfort.
Thank you very much. And thank you, Barbara, for that question. Can we talk a little, so thank you for also talking about treatments. Is there a way to reverse or cure PVD?
Yeah, I get that question all the time. There isn't a cure for peripheral vascular disease yet. Maybe down the pipeline. I wish that I invented it. I would have an island somewhere maybe. But what we can do is we can treat the process in the sense that we can treat the symptoms or what the process has caused, and then we can actually stop the process or stop the acceleration of the process. And that's really where the medications, the statins, come in that help with your cholesterol. To keep your cholesterol in check, it decreases the progression of atherosclerosis or plaque buildup in your arteries. And so that's kind of a way to stop that process. And then we have treatment modalities that from interventions that we can actually fix the plaque buildup that you have in your vessels. But there's no quote unquote cure for peripheral vascular disease in the sense that we can't get rid of plaque yet. Maybe in the future there might be, which would be fantastic.
Yeah, that would be. What about reducing your risk of developing PVD in the future? Are there things that you can do for that?
Yeah, I mean, I'm sure everyone is tired of hearing doctors use the words healthy lifestyle, but healthy lifestyle is really the ticket here. And so
yeah,
doing things like not becoming a smoker, or if you are a smoker, quitting, really developing an exercise regimen that's in your daily routine, whether it's every day or a few times a week, to get out there, and just even things like walking can really be beneficial. And then lastly, as we get older, it's important that we follow up with our primary care physician to really make sure that if we have any signs or symptoms of high blood pressure or high cholesterol, we're starting to treat that early. And also that if we do have a family history of diabetes or we are pre-diabetic, that we get a hold of that and actually treat our glucose and treat the diabetes sooner rather than later, before it can actually cause a problem in our bodies globally.
Thank you very much. We have another question from a viewer, from MJ. The question is Plavix useful in treating PVD? And for those of us that don't know what Plavix is, can you mention, is that a medication?
So Plavix is a medication that we use often in the treatment of peripheral vascular disease. And the way I like to describe Plavix is that it's kind of a super aspirin. And so we have baby aspirins, which I mentioned earlier. I think most of my patients are taking the 81 milligrams. And Plavix is kind of a super aspirin. And the reason that that's important is just that there's been studies that demonstrate that if you have severe forms of peripheral vascular disease in your legs or in the arteries that go to your brain, which would be your carotid arteries, that the addition of Plavix can help decrease the progression and the symptoms associated with those disease processes. So it doesn't fix anything. It just helps decrease the risk of symptoms and helps decrease the risk of progression. And generally, we don't use the Plavix until the disease gets rather severe. Before the disease gets rather severe, we use the aspirin. And then most of the time after we do a treatment, so for example, if I do an angiogram or the minimally invasive technique and we place a stent, then we will put you on Plavix then. Or if we use the balloon to open up a vessel, we do put you on Plavix, just because it helps keep the blood just a little bit thinner as it goes through there and decrease the likelihood of problems presenting.
Mm-hmm.
I hope that helps, MJ.
Yeah, I'm sure it did. Thank you so much. And thank you, MJ, for that question. We have another question for you from Lauren. The question is, or she asks, so I have fibromuscular dysplasia in carotids, renal, and vertebral arteries. Should I be screened for PVD as a precaution? So she knows exactly what she has. So
yeah, she does. So
doctor.
Yeah, we can say FMD for short, but fibromuscular dysplasia, and that's her carotids, her vertebral arteries, and her renal arteries. And so the carotids are the ones that go to your brain, the vertebrals go to the back of your brain here, and then the renal arteries that go to your kidneys. And those are the locations that FMD usually presents.
Thank you.
I don't think that it's a bad thing to get screened for a peripheral vascular disease, but honestly, unless you're having symptoms as far as pain in your legs when you walk, if we found something, we wouldn't want to treat that. The majority of us as vascular surgeons, we generally try not to treat the pictures, we try to treat the patients. And so if 10 people came in and 9 of them had disease on their ultrasound, or only 2 of them had symptoms, I would only treat the 2 people with symptoms. I wouldn't try to treat the other people with disease on their ultrasound, just because I want to make sure that I'm doing something that's going to help you. And so if you don't have symptoms, then there's no reason for me to do anything else. But I definitely don't think it's a bad idea to have a conversation with your primary care physician, or if you have a vascular surgeon, with your vascular surgeon, about the possibility of evaluating your lower extremities for peripheral vascular disease.
Thank you very much. And thank you, Lauren, for that question. I believe you touched on this a little bit before, but if you could talk again about the hereditary nature of PVD. Is it hereditary? Can you pass it down to your children?
It is hereditary, but not quite in the sense of peripheral vascular disease is a disease. So peripheral vascular disease it's a disease process due to other factors. And those other factors are the high blood pressure, the diabetes, the cholesterol. And so there are family histories or hereditary factors that play into this. And so there's families that have high blood pressure at early ages, or have heart disease at early ages, or have high cholesterol at early ages. And so if somebody in your families, for example, your mother or your father or your grandparents, have very significant heart disease or cholesterol, and they've had it since their 30s or 40s, then that's something that you need to keep in mind, so that when you become a little bit older, you're making sure you're going to your doctor and you're getting these checked out. So in that sense, peripheral vascular disease can be hereditary, but it's not, the process itself is not a disease. It's a bunch of small parts that make up peripheral vascular disease, or cause this process that we're talking about. And so if you have a family history of diabetes, high blood pressure, high cholesterol, or heart disease, those are all things that I would want to keep in mind for yourself, or for your children, to let them know that they might be pre-selected for peripheral vascular disease or blockages in their arteries.
Yep. Thank you very much. Yep, that makes perfect sense. So if someone believes that they might have PVD, what type of doctor would treat it? And I think you mentioned your primary care physician. Can you talk a little bit about the process for what who someone would see? Do they need to talk to their primary care doctor first and get referred? Can they go directly to a vascular surgeon? Can you talk about that a little bit before we wrap up our broadcast?
No, that's a fantastic question. I will say the primary care physicians they're just amazing. I mean, the amount of things that they cover and the way they treat people is just fantastic. And so they're really kind of the eyes and ears for the subspecialties out there. And so globally, they treat a spectrum like this. I mean, I treat just a tiny little bit of the body. And so the first step, I think, is actually having that relationship with your primary care physician, and then we depend on them to get some of the studies and decide whether or not this is peripheral vascular disease before they send you to myself. You're always welcome to call a vascular surgeon or a vascular surgery office. You can call my office, of course, and ask for an appointment. And you instead of getting a referral, you can just self-refer. That's 100% okay. A lot of my patients actually have endocrinologists or cardiologists as well that they talk to about these things, and those specialty services, the endocrinologist or the cardiologist, will often refer the patients to myself as well. And so there's a lot of different ways to get in to see a vascular surgeon, but the majority of the time I would start with your primary care physician or your cardiologist and go from there. But always feel empowered to call physicians yourself, or call physicians' offices yourself to get something checked out. I mean, we got to take care of us.
Yep, thank you. That's really helpful. Any other advice for our viewers as we wrap up, or anything else you'd like to share?
No, I would just once again, say that I think that for the most part, for vascular disease and just our health in general, another plug for a healthy lifestyle. So quit the cigarettes if you're a smoker, and get out there and start walking. It's beautiful outside. And if you have any further questions, I mean, please obviously reach out to me. You should have my information here. And if you are unsure about your health, go see a doctor, get it checked out.
Thank you so much. That is great advice. And we do have the phone number for you for more information or to schedule an appointment. We'll also include it in the comments. That phone number is 410-554-2950. And again, Dr. Crowner, thank you so much for your time. And thank you for sharing all this wonderful information about PVD. I know I learned a lot. I'm sure our viewers learned a lot. So we just really appreciate you taking the time to educate us today.
Hey, you're welcome.
Thank you for joining us. Have a great day, everyone. See you next time.
See ya.